Hello everyone. Our today's topic is placenta previa. So, what is placenta previa? It is actually a condition when placenta is inserted into lower uterine segment. Lower uterine segment. So that it partially or completely covers the os. So we will try to understand it with the help of a diagram. Suppose this is our uterus. So normally the placenta is inserted high up in the uterus, like here. It is in normal condition, placenta is inserted at fundus or high up in the uterus. So this is our placenta. This is our cord. While in placenta previa, placenta is present or inserted at lower uterine segment. It partially or completely cover the os, so it can leads to hemorrhage. So look at this image. In this image we can see this is normal uterine wall. This is our placenta that is inserted high up in the uterus, and this is umbilical cord. While in placenta previa, placenta is inserted into lower uterine segment. So look at this image. There are various grades of placenta previa. First one is grade 1. In grade 1 placenta previa, you can see placenta is low laying, but still it is not reaching up to the internal opening. So see, this is placenta in this condition in grade 1. This is placenta. It is just reaching up to os, but is not covering the os. This is grade 1 placenta previa. So grade 2 placenta previa, it is marginal placenta previa. In this condition, edge of placenta reaches up to internal opening, but still it is not covering the os completely. So you can see here placenta is reaching up to the os, but still it is not covering the os. Okay. So what is grade 3 placenta previa or partial placenta previa? In grade 3rd placenta previa, lower edge of placenta partially covers the opening. You can see the placenta is partially covering the internal os or the os opening, but it is not completely covering it. This is grade 3rd placenta previa. In grade 4 placenta previa, placenta is completely covering the opening. Look at this image. You can see placenta is completely covering the internal os. Risk factors for placenta previa. So it is more common in multi-parous women who have more than one children or multiple children. Placenta previa is more common in those women. More common in advanced maternal age. Previous history of LSCS or any previous scar to uterus due to some surgery. Smoking is another risk factor for placenta previa. So types of placenta previa. We already studied the types of placenta previa. There are 4 types. Type 1, low-lying placenta previa. Placenta previa. Type 2, marginal placenta previa. Type 3, incomplete or partial placenta previa. And type 4, complete placenta previa. Now we will discuss about clinical features of placenta previa. Patient will present to us with vaginal bleeding that is sudden in onset, painless. So placenta previa bleeding is painless, while the bleeding in placental abruption is painful bleeding. What is placental abruption? We will study it in another video. Complications of placenta previa. During pregnancy, antepartum hemorrhage, can lead to malpresentation, can lead to premature labor. How it can lead to malpresentation? This is our uterus. Here is complete placenta previa. So when in lower uterine segment there is placenta, head of the baby will not be able to engage, and it will freely float into the uterine cavity. That leads to malpresentation of the baby. Okay, what are the other complications during labor? It can lead to early rupture of membranes, cord prolapse, intrapartum hemorrhage. During purpurium, it can lead to postpartum hemorrhage, retained placenta, and subinvolution of uterus. So what are the fetal complications? Low birth weight, birth asphyxia, and intrauterine death of fetus can occur. So how placenta previa is diagnosed? See, patient present to us with antepartum hemorrhage. We'll ask the patient to do first investigation, ultrasonography. On ultrasonography, we will able to see a low-lying placenta or placenta inserted to the lower uterine segment. We can also do Doppler studies to look for any fetal, actually maternofetal vascular compromise. So how we are going to manage this patient? Complete bed rest, blood transfusion if excessive blood loss is occurring, continuous fetal monitoring, and then we assess gestation age of fetus. If it is above 37 week, do LSCS or lower segment cesarean section. If gestation age is still less than 37 week, then expectant management is done. Expectant management, our aim is to continue pregnancy up to 37 week. We give supportive treatment with continuous fetal monitoring. Okay, so this was our topic of placenta previa. We will do a quick review. So what is placenta previa? It is a condition where placenta is inserted into lower uterine segment. It can partially or completely cover the os or the opening of placenta and leads to various complications. And most important complication is hemorrhage. Most important complication is hemorrhage. So what are the various risk factors for placenta previa? Previous history of placenta previa, or multiparous women, advanced maternal age, or previous history of cesarean section or any scar to the uterus due to any previous surgery. Smoking also leads to placenta previa. So this is normal uterus, normal position of placenta. Placenta, you can see placenta is inserted higher up in the uterus. What are the various types of placenta previa? There are 4 types. Type 1 is low laying, type 2 is marginal placenta previa, type 3 is incomplete placenta previa, and type 4 is complete placenta previa. We saw this image. This is grade 1, low laying, but is not even reaching to the os. In grade 2, marginal placenta previa, lower edge of the placenta is reaching the os, but is still not covering the os. Grade 3 placenta previa, lower edge of placenta is partially covering the opening of os, you can see here. But in grade 4 placenta previa, placenta is completely covering the os. Placenta is completely covering the os. These are the various type of placenta previa. So what are the complications of placenta previa? During pregnancy, it can cause antepartum hemorrhage. It is the most common presentation of placenta previa. Patient will come to us with bleeding. It can cause malpresentation. It can cause premature labor. During labor, it can cause early rupture of membranes, cord prolapse, and intrapartum hemorrhage. After delivery, that is in purpurium, it can lead to postpartum hemorrhage, retained placenta, and subinvolution of the uterus. What are the various fetal complications? It can lead to low birth weight, birth asphyxia, and even intrauterine death of the fetus. How it is diagnosed? Patient comes to us with antepartum hemorrhage. We do a USG and we will see the low laying placenta on ultrasonography. So then we do Doppler studies to look for any maternal-fetal vascular compromise. What about the management? If blood loss is not very excessive, give complete bed rest to the patient. Blood transfusion if excessive blood loss is occurring. Our aim is to continue the pregnancy up to 37 week if gestation is less than 37 week. If gestation is more than 37 week and patient is losing blood, we can actually do cesarean section or even normal delivery if placenta is not covering the os completely. If the pregnancy is less than 37 week, we do expectant management. Our aim is to continue the pregnancy up to 37 week. We give supportive therapy and do continue fetal monitoring. Once the pregnancy reaches beyond 37 week, we can do normal vaginal delivery or even LSCS if required. So this was our topic of placenta previa. Thanks for watching this video. Like and subscribe Mini Medicos.